So there, of course, are a number of very important counseling points that we do need to make for these biologics because they are very complex, high-touch medications, and for the most part, the gross majority of them do suppress the immune system. And so, of course, it varies by determining, which medication it is or which medication class, but of course, the first and foremost important thing we need to discuss is assure them that they will be able to afford their medication and what steps we will take to ensure that that happens. Secondly, we need to counsel them on how to administer it because that's very important and potentially can be a deal breaker for patients where we do have to go back to the drawing board because they're not comfortable or physically unable to self-inject and they need an alternative option. Or perhaps the oral options may interact with some of their other medications because they have a number of comorbidities that they're also managing. And a lot of these medications, they cause immune suppression, and so another big concern that we have to mention to them is the risk of infection and the necessity of holding these medications when they're ill, as well as in preparation for any surgical procedures that they may have, because if they continue these therapies, they could potentially have some secondary issues that arise that you then have to manage those as well in addition to their psoriatic disease.